Welcome to this edition of the Legislative Reference Bureau's Oral History Project. Today we're talking to former Senate Majority Leader Judy Robson. Judy, hello. Thanks for coming.
Happy to be here.
I wanted to ask you, we usually start at the beginning. Where were you born? Tell us about your early life and your education.
Oh, sure thing. I was born in Cleveland, Ohio, and moved to Wisconsin as soon as I found out about it. We loved Wisconsin. We moved here because of Beloit College. My ex-husband was a Beloit College professor. My education was, I'm a registered nurse, and I went to a college called St. John College, which is now morphed into Ursuline College. And then I got my master's degree here at the University of Wisconsin in Madison and became a geriatric nurse practitioner. And I practiced nursing for about 25 years before I became a legislator.
When did you come here?
We came here in 1966. So I worked at various jobs in Beloit. I worked the emergency room at Beloit Memorial Hospital. I was a public health nurse. I was a nurse practitioner working in private practice at the Beloit Clinic. And I also worked in various capacities, but taught at Black Hawk Tech in the Associate Degree Nursing Program. So I did a little bit of every kind of nursing there is.
What were your various roles at Black Hawk?
I taught nursing. I taught the beginning nursing. We developed videotapes to teach the students how to do different skills. And then I also taught advanced nursing, clinical, critical care nursing. We went into nursing homes. We did a little bit of everything. We were generalist educators.
How does that lead to you being in the State Assembly?
Well, interesting you should ask. My political roots began in the 60s. I really admired President Kennedy, and I heeded his siren call about the importance of public service. And I always had that in the back of my mind. And I think nursing and legislatures have kind of parallel tracks in some ways. As a nurse, you want to help people who are vulnerable and voiceless and powerless and help them get their strength back, point them in the right direction so they can keep their health, and also help them when they're having difficult times. And you're there as a helper. And I saw the legislature as being the same thing, helping people who are powerless, voiceless, and trying to improve their lives. And as a legislator, I found, actually just going back a step, when I was a registered nurse and working as a geriatric nurse practitioner, I was finding that hospitals and the healthcare system was morphing into something that was something that I didn't understand didn't like and maybe didn't appreciate. In the mid-'80s, healthcare started to become an industry. They started looking at bottom lines. They started looking at profit centers. They started hiring photographers and PR people, and yet bragging about nurses, but yet nurses were not necessarily the most important part of the system. And nurses were overworked, underpaid, and treated with a lack of respect, I thought. And so that really kind of bothered me a lot. And then when I was working as a geriatric nurse practitioner, I found that as a nurse practitioner, insurance companies and others would not recognize the importance of the advanced practice nurse as she was trying to help people and trying to save money and improve the quality of people's lives. And the physician that I was working with at that time, and I wrote articles, we petitioned insurance companies, we went before boards to say that the practice, the nurse practitioner practice that I had, the advanced practice nursing practice that I had, was saving their money. For example, we would have a lady who was very lonely and at home, and she would call the ambulance, and she would end up in the emergency room 7 or 8 times a month. And I took her under my care and was able to find out what it was about her life that she was so needy that she had to have that stimulus and that friendship and that need for friendship or contact with others that required her to call very expensive ambulances. So I intervened, and we were able to cut that way back, and she stopped calling the emergency room, and she stopped calling ambulances. And there were other times when I would help people that had high blood pressure and teach them how to take care of their high blood pressure, to stay on diets, learn how to take care of themselves, exercise, and all the other things, and then you could prevent them from stroking out later, which is very expensive. But the insurance company said, we don't pay for preventative care. We don't pay for advanced practice nurses to do this. And I would take care of an older patient, very complex, with lots of medications, lots of social issues, lots of other things that impacted how they lived and how their health was. And I would stay with them for 45 minutes in the clinic and try to intervene and teach them and to help them. It made a tremendous difference. And yet we wouldn't be recognized. The physician had to come in the room, wave, and then everything was okay by the insurance companies. I know that's changed a lot since then, but that was sort of the feeling that I had, was that nurses were the biggest healthcare provider in the system, yet we were not recognized and we were powerless, and it was time for a nurse to be at the policy table. So I decided to run. And
Were
there
you
was an
politically
open seat.
active before?
No.
So 1987 is...
1987, I said, I had already been teaching nurses to get politically active and to contact their legislators and to talk about nursing issues, but I never ran for anything, not even for school board or city council or anything. And when I ran in 1987, it was a special election. And nurses and women and non-incumbents have a chance to win when there's no incumbent. And the person before me was Tim Cullen, became Secretary of the Department of Health and Social Services for Tommy Thompson, Governor Thompson. Tim Whedon, Representative Whedon, decided to become senator, so he ran. So then Representative Whedon's spot was open, and we have a good chance to run and win if there's no incumbent.
How do you start? Well, you say we. Who's we?
I put a kitchen cabinet together of people, and we scribbled out an envelope of my budget. We thought maybe we could come up with $750 and run. And then others came in. There was a group called the Caucus, the Democratic Party, and they came in to kind of help me. But I really talked to nurses, and we were my family and nurses, and we put together a white shoe army, the white shoe brigade.
Is that what you called it? The
yeah,
white
that's
shoe
what we
brigade?
did. And the election was quickly called. It was it called in 6 weeks, because the Republican who was running against me was quite popular and well known. He was a police chief. He was on a school board. He was a very popular auctioneer, and he was well known. I was not well known. I was teaching full-time. I had students in a nursing home full-time working, so I had to find time after I was teaching and on weekends to campaign. So we put together this plan, which is who is going to come out in the middle of June to vote. And we got a voter list, and we figured out who would come out. Very few people come out in June in special elections. So what I did was I went door to door. And in 1987, that was fairly rare. I think most everybody does it now. And it was very hard because you see people out on the street, or you would have to skip almost 10 houses to get to a voter. And you think,
How
well,
did you
maybe I
identify the likely voters?
There's a voter list.
Based on how they had
their
been.
voting history. We could see they voted in presidential, governor, special elections, school boards, and they were very, very, very consistent in their voting. So I would visit them, maybe one on a street, maybe two on a street. Very hard. My kitchen cabinet said, you should be doing what your opponent is doing. He's doing the chicken dinners, he's doing the ice cream socials, he's going downtown, he's shaking hands. You should be doing that. And others said, no, 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 you stay with those voters. You stay with those voters. You know who are going to be out and visiting. And I did have an advantage, even though I didn't have any name recognition and I had no political background, is that nurses are authentic and people like us. And I would go to the door and people would open up their door, they weren't afraid, and we would talk about everything about their, other than politics. We talked about their garden, and then as soon as they found out that I was a nurse, their complaints came out about their health care and what they should do and their illnesses and medicine and things like that. So I felt like I was an old public health nurse. And then 6 weeks later, it ended, and all the cameras, radio, pundits were all at my opponent's campaign headquarters, and I was there with my cadre of nurses and friends and kitchen cabinet folks. And then about 8:30 we realized I'd won. So then they all had to unplug everything and come over to my campaign headquarters. And then I said, now what?
So you were in.
Elected.
You had your place at the table. What was that like?
And it was very...
The session was already going.
We were in the middle of the budget.
Middle of the budget.
Middle of the budget. And you know what the budget is like. It's chaotic. Everybody is trying to get their amendments in, understand what's in, vie for attention, and try to persuade people. And I didn't know the legislative process.
Did you know what was going
on?
on?
I didn't know
who
what was
took you
going
under their wing? What kind of staff did you have?
Well, I had no staff.
Okay.
I was supposed to have an office, and the Republican that I was replacing, wouldn't give up his seat, and he wouldn't give up his office. And we really struggled because I didn't have an office. So Tom Barrett, who was a rep at that time, who then became a senator and then a congressman, and now he's mayor of Milwaukee, took me under his wing. And so I had a little corner in his office and a little bit of a phone that I shared a phone with him for almost 2 weeks in the middle of the budget. But then I also had Bob Lang from Fiscal Bureau come over and kind of help me as best he could. He was in the middle of all of this as well. But I think being a nurse, though, you have problem-solving skills. You come in with a certain set of things that you know how to do, and you just figure out the terms and figure out how to make it work. And so it happened. But it really was overwhelming to be parachuted in the middle of the budget. And those were the days when there wasn't air conditioning in the building. And we would be sitting in a very hot caucus room, sweating, arguing, fighting, crying, people crying. And I was so disturbed with people crying and saying, we never take care of the farmers. What's wrong with the dairy farmers? Why can't we help them? And burst into tears. I didn't realize there was a lot of theater in caucus, but I figured that out. And then I finally said, when we were really hot and very miserable, I said, why don't we go across the street to the hotel where it's air conditioned and we can continue having this conversation. This is not healthy for us to be in this room. And I got labeled the nurse legislator after that, trying to take care of the caucus, which I didn't mind. I wear that label very, very proudly.
What was your suggestion taken, or did you stay in the caucus room?
We stayed in the caucus room, yes. They stayed because the leaders wanted us to be hot and miserable so that we could get through that process a lot faster. It was fun.
Well, in your early sessions, you seemed to have a good deal of success in advancing legislation in your favorite subject area, healthcare. Can you describe how that went?
I think that given that background of healthcare and being in the system for 25 years really gave me a lot of motivation and a lot of momentum as well, and also gave me a lot of gravitas in the caucus because I was a nurse. And so the leader put me on health committees, and then I eventually chaired a couple of health committees. And so one of the first bills that I passed was to work on articulation agreements between the technical colleges and the university so that student nurses could move and get a bachelor's degree much easier. And then I required that insurance companies require mammograms to be required by insurance companies. And of course, we heard the old, oh no, another mandate from insurance companies. This is going to be very expensive. And it turns out, and because I think I had such a strong nursing voice, that I'm saying if you can pick up a lump or early cancer with a screening mammogram, then you would save lots of money and grief down the road. And so they still didn't like it, but I was able to pass that bill. And then I got very, very active in trying to advance the position of advanced practice nurses, because there were so many people without health care and they couldn't get to doctors, or there weren't enough doctors in very rural, poor areas, that I thought if advanced practice nurses, nurse practitioners, nurse midwives could be able to prescribe medications, they would be able to improve the lives of patients by having patients have access to health care. So that was a long undertaking. It was very controversial. But
You worked it through multiple sessions?
Multiple sessions, at least 2 years, and lots of good help from a lot of coalitions. But some of the difficulty with advanced practice nurses prescribing medications was that there's a lot of territorial control by physicians and pharmacists and hospitals and others who thought that nurses shouldn't be able to do this, that life as we know it on this planet would end, Western civilization would be doomed, and the healthcare system would implode, certainly. But through the years, academic nurses had done lots of research on advanced practice nurses and found they were not only safe, but they improved the quality of life for patients, and so that having a nurse prescriber would not be unsafe. So that was, we had good research to validate what where this bill was going. We also, timing was everything. At that point, Hillary Clinton was introducing her health care plan, and it was very controversial, as we know in retrospect. However, the physicians came like gangbusters against the health care plan of Clinton's. And so they had a lot of fires out there surrounding that plan, and then they were starting to put fires around nurses who are authentic and liked and well respected. And so they lost a little bit of steam opposing it. So when I was terrified, they don't know this, I was terrified that when they came to testify, that they would testify against the bill. And they testified being neutral, neither for or against, which helped. I also had some help. I mean, it's timing, but it's also good help. The speaker in the assembly was Wally Konnicki, who was a nurse, so he understood nursing. The Senate president was Brian Rood, Senator Rood, whose wife was a nurse practitioner. So I had a lot of people out there who understood the issue and realized how helpful it could be to patients and to the quality of health care. So we were able to get the bill passed after a lot of work, a lot of intensive lobbying, and a lot of goodwill at the end.
I noticed in the '93 session you had a plan for universal health insurance that you authored, and it did make it to the floor of the Assembly.
Yeah.
What are your memories of that bill?
My memories of that bill was that Governor Thompson had introduced a bill, and everybody had been campaigning that year on the cost of health care, that people were getting excluded from health care, that businesses, small and large, were having huge problems with the cost of health care. So the timing was right, very right, for doing something in health care reform. So Governor Thompson put something in his budget about it. It was very anemic from my standpoint. And so we put together the Health Security Act, which would cover so many more people than the governor. I think we said that we would cover 350,000 people. We would keep the employer mandate. Right now we have an employee-based healthcare system. We didn't want to change that to anything else. The Senate had single payer, so they were coming in with their plan. I think Representative Rosenzweig at that time also had her plan. So there were like competing plans, Republicans and Democrats competing about who was going to have the best healthcare reform plan. I mean, that was a good place to be, rather than, no, we're never going to do healthcare reform, sort of the mentality right now. So we were able to figure out how to push it forward. We were going to fund it with an increase in the cigarettes. I think we said a penny for prevention, or maybe 5 cents to increase the cigarette tax to pay for it. And then it just sort of fell apart because the insurance companies and very, in that the lobbyists that represent people that don't want health care reform really came like gangbusters on it and kind of smashed it to smithereens, and it never saw the light of day. But I always say that you step forward a little bit, inch forward, and maybe you get pushed back, but then the next time you can push forward again. And when we were in the Senate, we put together no holds bar universal health care plan, And that, there's another story around that. But other states were forging forward. And I think we set the table then for the federal government to say, the states are laboratories of change. They're the place where the action is. Nothing was happening at the federal level. Look at what Massachusetts is doing, Vermont. Now Wisconsin has health care reform. Maybe it's time that we did it too, and let's look at what they've done, what didn't work, what we like about theirs, and then move on. So I always feel that you didn't really look, maybe you didn't win the bill that time, but you won in the long run. And when I saw Obamacare being signed at midnight, and I think it was Representative Obie, who was in the chair, I waited till midnight to watch that. And I teared up and I said, some of my life's work is done. We finally have universal health care.
You considered that kind of a culmination?
Yeah, right. Of all the pieces that we had put together through the years.
In '94, your caucus lost the majority in the Assembly. What are your memories of that? I mean, 24 years you'd been in the majority. How did the caucus react to that?
Oh, we were demoralized. We were used to being in charge, setting the agenda, having our bills passed, having our amendments passed, and we had to really take a back seat. And we were trying to figure out what we did wrong. And I don't think we ever came up with a conclusion. I think it's part of the swing of politics. One party is in charge, and maybe they get too strong or too heady or something, and then the pendulum swings back the other way. But in some ways, being in the minority is different because you're always on the no side of things. So you can propose things knowing it's not going to go anywhere, but you can make a negative point, and it's easier to be negative than positive sometimes. So we did our best to try to get back the majority, but we kept on slipping and losing seats. Part of it was, I think, the rural areas were getting stronger. Milwaukee was getting weaker, and a lot of our strength from the majority was coming from Milwaukee. And the gun issue popped up a lot, the abortion issue popped up, and so we were getting kind of whiplashed with those issues and never really got our arms around it.
So in '98 you ran for the Senate. Now, it seemed like Senator Whedon announced he wouldn't run. Did you see that coming at all?
I didn't see it coming at
all. You
all.
were planning to run for re-election to the Assembly that year?
Yeah, I was, and then he decided not to run. He's a very good senator. I really enjoyed working with him. He was a Republican, but we both represented a 50-50 district, and when we were back home, we got along. We didn't criticize each other. I know that various leaders in both of our parties wanted us to beat up on each other. They'd say, we did this when he was co-chair of finance. You should really go after him. I never did. And I know he was getting the same message. Go after Robson.
You both had people giving you that
giving
suggestion.
Us and we had similar leadership styles. We're sort of low-key, policy wonks, and very, very kind of likable. And so we never did that, and we always remained friends. In fact, I see him every once in a while, too. And so when he ran, I decided to run, and the rest is history, I guess. I won. Surprised myself.
You did surprise yourself.
Yeah. Oh, I surprised myself when I won for the Assembly, too. Nobody gave me a prayer. You're just a nurse, you're a woman, you don't have a chance. And in fact, the Democratic Party in Rock County ran an opponent against me in the primary because they didn't think I was strong enough. So I surprised him then, and then I surprised him again when I won in the Senate.
Even though you were incumbent representative, they had somebody else they would have rather had.
Yeah, I think so. Right.
So 3 times the constituency. Is it a much harder campaign?
Yeah, much harder campaigning. I still did doors, but I knocked on doors, and I had people helping me knocking on doors. But I would go out at 10 in the morning until 8 or 9 at night. I really, really didn't like daylight savings because I lost an hour of campaigning. I'd have flashlights walking around. I think that was the summer when it was very, very hot and like 90+ degrees. And I showed up at a lady's door after campaigning for 4 or 5 hours in the heat. And she looked at me and said, I thought your hair would be better. Women legislators always have problems like that. It's always about the hair. You know, they did that with Hillary as well. But I just kept on forging ahead and kept on walking. If it was raining, I was out in the rain with my umbrella. I'm an avid biker. I still am. And in rural areas where there was quite a distance between houses, I hopped on my bike and went door to door on my bike. And people still remember that. I remember you walking in the rain. I remember you being on the bike. I remember you at my door. And in fact, they would call my office for constituent help, and they'll say, I really know Judy Robson because she came to my door, and blah, blah, blah. So they saw me as being a real friend.
You're incorporating people outside of Beloit now, I mean, outside of your area.
Right,
Yeah.
right. So that, and I also had a lot of help from my family and the nurses. I can't say enough about the nurses. They're not too political, but they did get behind me and really understood what a nurse and the legislator could do for patients and for the healthcare system. So they really did help. And nurses, as I mentioned, with their white shoes out there knocking on doors helped a lot.
So in '99, you're in the Senate. Can you describe what's the difference between the Senate and Assembly? You've been on both sides.
Well, I thought that the Assembly in some ways was a little bit more fun. It was just, maybe there were more of us. We seemed a little bit more friendly. In the Senate, you had your own office, and it seemed a little bit remote from everyone. It was very, very prim and proper. We sat in our seats to vote. In the Assembly, there was all the ghost voting. I don't know if they do that or not, but people would be in the back room having their lunch, and there would be a vote called, and somebody would vote for everybody, or 5 people in their row. In the Senate, you had to be in your seat during the roll call. You could not move. You addressed each other very properly. There was a dress code. If you spoke to someone, you always addressed them by a senator, their name, but you always had to look at the president of the Senate when you talked. You didn't look at that person. The rules and the code of conduct were very, very formal, very respectful, and I grew to like them very much because I think it offered a decorum and it gave a presence, and it also underscored the importance of what we were doing. We were passing legislation that was going to have a huge impact on people's lives, and we should be and ought to be and ought to look and act very part of that role and be very respectful and have and maintain the traditions of the beginning of the Senate in 1868.
1848.
1848. Yeah.
Right.
Thank you.
What was your role in the prescription drug program? Wasn't there some legislation passed around 2001?
Well, I was the author of that bill. And again, it was timing. Everybody was hearing during the campaigns from seniors about how high prescription drugs were. We were hearing from people who were making, on Social Security, they were making $1,200 and their prescription bills were $800. I don't know how people did it, but you had to choose between medication and food sometimes. Patients were cutting their pills in half, which is very poor medicine, very, very poor health care. So we introduced a bill, and it was called WisconCare. And at the same time, Tommy Thompson had again put a little piece of prescription drugs in place, and then he moved on. He became Secretary of the Department of Health and Social Services. And so we had, the governor was Scott McCollum at the time. And then we also had the Assembly that said that they would also have a prescription drug plan. So there we had Republicans and Democrats vying for a prescription drug plan. And as it went through the process, I think this was a beautiful example of Democrats and Republicans working on an issue and finding some middle ground. I had to give up a lot. My bill would have covered 350,000 seniors. We pegged it at the income of Homestead, which I think was around $29,000 for a single person and $35,000 for a married couple, and that you would be eligible for prescription drugs. You would only have to pay so much for a copay, and you would get these medications at a very reasonable price. You know, and the question is, where do you get the money? Well, we always found money with the cigarette tax. Nobody likes cigarettes, or at least nurses and doctors and everyone else
That's how you
doesn't like
funded this
cigarettes.
particular
Yeah,
legislation.
yeah. And then the Assembly had a bill that was very modest, and we beat them up. You go through all the rhetoric. Oh, that's a terrible plan. It doesn't cover enough people. It scaled it back by almost half on the number of people that would be there. And then the governor, McCollum at the time, had his plan. Then it went through all of the committees and really had a lot of momentum. Then it went to finance. And then the governor gets involved in some of the negotiations with finance. So then it morphed into senior care. From Wisconsin Care became senior care, had a different label. We scaled back the number of people that could be covered in part of the compromise. The Republicans went up on where they were. So we found this sort of halfway point. And senior care is one of the most popular programs that we have for the state of Wisconsin. And we continue to fight it. The federal government has tried to shut that program down so many times. Part of it, especially after Medicare Part D went into place. And Wisconsin was the only one that still had a freestanding prescription drug plan. And ours was cheaper than Medicare Part D, partly because we negotiated with pharmaceutical companies to get the best price possible, and the federal government didn't. So they tried to shut us down, and we would petition and beg and send letters, and AARP and all the red shirt armies and nurses would all be petitioning, and they would give us another 2-year waiver. And then the 2 years would be up, and again, I remember Representative Hipsch, who was the speaker at the time, and I went to see the Secretary of the Department of Health and Human Services from the federal government. He was there in Milwaukee, and Mike Hipsch and I went over and begged him to keep senior care going, and then we got another waiver. And it seems like that's never stopped. It seems like every 2 years we get another waiver, and it keeps going. It's very, very popular, and I was very proud to have been the author of that bill.
I see you started to go up the leadership ladder in the Senate, which you didn't seem to do in the Assembly. Is it just, what was the reason? Did you have a different ambition?
Yeah,
Or?
well, I was the caucus chair in the Assembly.
Okay.
So, yeah, so I did have a little bit of a role to play in leadership. I never ran for leadership, and when, I don't know if I never aspired to it or what, but to be minority leader, I never really ran for it. They asked me to run. I got a call the day of the caucus, and I was still in Beloit, and I got a call from one of my colleagues who said, "We'd like you to run for minority leader." And I said, well, there's others that are probably much better suited. I thought of Russ Decker. He would be, he's been there longer, he's been on finance, maybe he should be minority leader. No, we want you. We think we have the votes for you. And then called back in about an hour and said, we got the votes.
Who was it in particular that contacted you?
Well, it was Representative, there were several that had called. Some slipped my mind right now, but they did call. And so I went to caucus, and I thought, if they want me to be their leader, I would be happy to be their leader. I'm honored to be their leader, and if they think I can do it and I have the capacity and the ability, I will become the minority leader. And
this is following the caucus scandal.
This was called, yeah, and it was right after the caucus scandal when 5 legislators were indicted, and there was a pall on the legislature. There was a dark cloud over us. We lost our credibility, the legislative process, the legislature were all looking very poor, and we needed to restore public confidence, and I think maybe that's why they were looking for me, that nurse thing, the mother thing, let's soothe and being sort of a low-key, not too flashy. I wasn't, a bombastic, screaming at the top of my lungs leader. Women leaders tend to be more collaborative, team building, and trying to have everyone be on the same page without taking, ego credit for anything. It's a team effort. And so my job as minority leader was to get back the majority. That was my focus. We had to get back the majority. And
how did you
there's
pursue
that? 2 ways to pursue it. Well, actually 3 ways. Find good candidates, and we had outstanding candidates. Senator Weinhaut, we had Senator Kreitlow, we had Senator Lyman.
This is 06.
Yeah, running very, very strong candidates. Raise money, which is very painful and very difficult, and also have a message. And we had a strong message. We put together a family-first agenda, which included healthcare reform. We were going to put universal healthcare reform in place. We were going to reduce property taxes through HOPE, which was the homeowner's property tax exemption program, where we would exempt the first $30,000 of your assessed value of your home, which is very progressive. We also put together, and we were going to fund it with closing the Las Vegas loophole.
You're going to exempt it from property tax, or?
Yeah, and fund it with the Las Vegas loophole. We found that many big financial institutions, big banks, would morph into another state like Las Vegas, did not have to pay any taxes in Wisconsin, and we would close that loophole, and it was millions of dollars, and we could take those millions of dollars, I'm talking about like 351 million, don't quote me exactly, but I mean, you know, $300 million, and then we could plug that into property tax relief. What was very good about HOPE in exempting the first 30,000 is that people who were of lower income saw a bigger amount of reduction in their property taxes. So if they owned a house that was $75,000 and they exempted $30,000, they didn't have to pay but $30,000 on the assessed value. If you were somebody in Wauwatosa, for example, that had a $500,000 home and you got a $30,000 exemption, the percentage was not as great. So we had a very strong agenda. We also talked about changing ethics and campaign reform. We talked about changing the way the Senate worked, the process of the state Senate. So we had a strong agenda, and we had good, strong talking points for all of those, and we gave those to very strong candidates who marshaled those messages, and people responded to that call for healthcare reform, you know, closing the Las Vegas loophole, having people pay their fair share, having property tax relief, so that we could help provide stronger schools as well.
So you were majority leader.
I was the majority leader, right. Since I won back the minority, I didn't do it by myself. When I say I, you know, there was a huge team of people that were out there helping raise money, and that was, as I mentioned, painful. You'd have to go down to the Democratic Party room and be in a little hole, little cubby hole.
Where's that?
It was down on, there were a couple places. It was Martin Luther King Boulevard, and then there was another place that they moved, a little higher end place down on Fairchild. So you'd have a phone, and you'd be given a notebook, and you'd start dialing for dollars constantly, and then having fundraisers. So I spent a lot of time as minority leader on the road. I would drive to Eau Claire and back in one day for a fundraiser. I would be visiting Milwaukee, visiting attorneys, and visiting high donors in Milwaukee. I would visit people that I never thought I would ever meet in my life, and one thrill was meeting Judy Faulkner with Epic Systems, and people like that, you know, very charming, very interesting, very powerful people. So it wasn't all that bad raising dollars, but you really had to do that. So you had to have good candidates, a good message, and enough money to be competitive.
You had a larger caucus the next year, and you were in the majority, and several new members who you would probably help get elected. So you were back, as majority. And what was your priority?
The first priority was to change the rules of the Senate. And the first job and the first bill that we pass are the rules of the Senate. And up till this point, a bill could be passed without having a public hearing. And we changed the law, or the rule that the Senate operated under, and said, if you have a bill, it must have a public hearing. The second thing we did was a committee would have a public hearing on a bill, and then they would vote on it. But they voted in secret. It was by polling, and they would do it by paper ballot. And I said, unless there was some great emergency, that the committee had to vote in front of the public, in front of the press, so that the senators had to defend their position and say why they were for or against a bill, and do it where the public operated. I was trying to change the culture of the Senate. That was difficult. There was a lot of pushback on that rule, but it just seemed like we ran on opening up the process, making it more accountable, making it more honest, and to have the public included and have a brighter spotlight on open government. So we had to deliver. So we passed those rules, and the Senate passed it. It's in the form of a bill, and they passed that bill. So that was one of the first things that we did. And then the second thing is you create the agenda for the legislature and meet in our caucus and discuss things. And one of the things that we said we wanted to do was pass universal health care. And so we rolled up our sleeves and put together a very good universal health care reform package. We were of the mind that the federal government was never going to do anything about health care reform. And the states were becoming the laboratory of change. I was part of a group called the Reforming States Groups, and we were encouraged and supported, and we had meetings to push us along and say, states, just go ahead and do it. Massachusetts did it, Vermont did it, and we wanted to do it. We also had, timing, as I mentioned, is everything. People were bubbling up with their ideas of healthcare reform. AFL-CIO had a healthcare reform plan. David Reamer and his group had a healthcare reform. I think the nurses had one, doctors. There were a lot of people that were pushing at this issue because we couldn't sustain the cost and the lack of quality in healthcare any longer. So we forged ahead and took some of the best ideas from other states and what David Reamer had done and what David Newby and AFL-CIO had done and the nurses and doctors, and put it together. And in one of our caucuses, I became sort of the academic chair. I assigned to various senators a job on a piece of the health care reform plan. One looked at what other states had done, others looked at and reported on what AFL-CIO David Reamer was doing, others looked at what the cost would be, and they did their research, and then it was almost like a legislative council study, a mini legislative council study, and then they came back to the caucus and reported. We also had one of our new senators, Senator Kathleen Weinhaut, had a PhD in healthcare, and so she really gave us a lot of gravitas for what we were doing at the time. She could read these policy papers and understand them, and some of us were struggled, but she got it right away. So they reported back, and it looked like there was a lot of buy-in and with people making their reports, and we were about ready to introduce Healthy Wisconsin, and then we decided to have, I organized a caucus where we went off campus or went out of the legislature, out of the building, and we went up to the Dells, where you're in a closed area and sat down with the senators and some of the others that were, some other groups that were very interested in us passing healthcare reform. And we came up with consensus that we were going to do it. And then once you had buy-in and I had the votes for the bill, then Senator Urbanbach, who was chairman of the Health Committee, took it on the road, and he did a very good job of organizing healthcare committee meetings, standing room only meetings, a lot of press around all of those healthcare committee meetings. So we really, really had a lot of energy. At the time, the Assembly was Republican, and they wouldn't even think about health care reform. And Governor Doyle didn't have quite this vision either. So
you didn't have high hopes that this was going to be enacted that year?
We were hoping. I mean, we were very, very hoping. But we were also thinking that we could pull it off by putting it in the budget. And so probably not the best. I mean, I have been one of those that say you shouldn't be putting big policy items in the budget. But we knew if we passed it in the Senate, the Assembly would never take it up, and that maybe if we put it in the budget, we could negotiate something from them on health care reform. So we put it in the budget, and we were severely criticized for putting it in the budget.
This is one of the longest budgets, longest delayed budgets we ever had.
Right. It was a very difficult budget. Part of it was there were 2 against 1, so to speak. You know, we had 2 Democrats, Doyle and myself, Decker and Jauch, and then we had Representative Hipsch, the speaker, and he couldn't move his caucus other than to say that they would, they had this no tax increase policy. And they were very, very firm on that. They would not move. We got to the point
These were
where...
members of your Democratic caucus?
No, this was his caucus,
His
the
caucus, okay.
Republican caucus. And we would agree to things, Doyle and I and, Decker and some of the others, and then he'd go back to his caucus, Hips would go back to his caucus, and they'd say no. So we'd have to start over. We just couldn't get them to come at all towards us, and we gave up a lot. And in fact, we gave up Healthy Wisconsin, which probably was some of the things that I got stabbed in the back for, because they thought I gave it up too soon. But we weren't getting a good budget. We weren't getting any good negotiating. And we couldn't get the Assembly Republicans to move. And we thought if we gave up this big chunk, that they certainly would move. And they didn't.
It went into October.
Yeah, went into October. And at one point, Governor Doyle called us into special session. That didn't work. He called us to the mansion. We were negotiating at the governor's mansion with Hips, and no go. And then finally, it was the pressure was on. Things started to fall in place. The governor got very active. So did Hips. So did I. And all of a sudden, it pulled together, and it was done. Very hard. But it was a good budget. The senators got all the things that they wanted except for Healthy Wisconsin, which really, when you think about it right now, was not terribly possible to get a universal health care plan that raised, that cost $15 billion. I mean, it wasn't, we thought we'd get more than we did on Healthy Wisconsin, but we didn't. But we got a budget. And the road builders got what they wanted. They got their road money, and we got things for sparsity aid for rural school districts that Senator Weinhaut had been petitioning for. We got increased in school aids. We were able to get some property tax relief. We didn't get all of Hope in, the exemption for $30,000 from assessed value of your house. We had to scale it back to 5. But we thought at least if we start at 5, then maybe the next budget we could get it to 10 or 15, and we were going in a very progressive fashion. So all the things that the senators wanted in that budget that were their priorities for their district or for what our agenda was, they got.
Well, within days of enactment, you were out as majority leader.
Yes, right.
What happened?
Difficult to say. I was surprised, but they asked me to be minority leader and asked me to be leader, and then they asked me not to be leader, and that's democracy. I certainly can't say I was, hurt, especially by people that I thought were my friends that I had helped, getting them things that they wanted in the budget.
It was very intimate on the Senate side. It's like 18 people.
Yeah, 18 people, right. And so if they didn't like you, and they didn't want you to be leader. And what they said was they wanted a more muscular presence. And I think that women leaders tend to be more collaborative and team building, and everybody participates, and you don't really have the sense that it's all about I.
You'd alluded to that in some of the contemporary press coverage, that it was a gender issue.
Yeah, I think so, yeah. But nobody wants to say it in so many words. But if they gave me the gift of leadership and then they took it away, I serve at the caucus as well, and they didn't want me to be leader.
Some of the people who backed you in January must have been against you in October.
And I lost by 1 vote, which, and that person wasn't there. He had a speech, and he wasn't even in caucus. And I think we could have made a fuss about the fact that he wasn't present in caucus at the time, but he left his vote. Fine. They didn't want me to be leader. I worked very hard for them, and I enjoyed it. It was a privilege to serve. But I have to say I was a little bit taken back and a little bit hurt.
What was the rest of that session like for you?
Well, it turned out to be okay. They put me on finance, and that's a privilege to serve on the finance committee and to work on another budget.
That was the first for you. You had never been on it before.
I had never been on finance, so I really got a very plum of a position. So I thought that was a nice concession on their part to give me a position on finance.
And then the next session, you had the assembly as well. 2009.
2009. Yeah. Yeah, I thought Hips was still the leader.
07.
and 7, and then 9.
09, Sheridan was
Sheridan became the
speaker.
right, yeah, good friend of mine,
and that,
right?
that enabled something like Healthy Wisconsin to go forward.
Yeah, yeah, and the assembly didn't take it up either. Yeah, we did push, but it was time. Yeah, Mike Sheridan was a very good speaker, and we could have done a little bit more. I think if I had been leader in 2009, I think Healthy Wisconsin would have been really pushed a lot harder. I think we would have done something about issue advocacy. That was one of the issues that I had worked on all the way along. You know, having shadowy groups come in with a lot of money to control elections, and you don't know who is paying for it or how much they're paying for, and making them accountable. I think we could have done something like that. And one of the regrets was not doing something about redistricting. We should have really changed how we do redistricting.
How seriously was that considered?
Not very. We didn't consider it. We always, when we did redistricting, we put together a plan that, of course, had our advantages, and the Republicans did the same, and then it went to the courts. And the court was nonpartisan and made the maps. And now we have this situation.
Was there an assumption that the next session you would still be in and
Yeah, and we would just
draw the maps as you like?
Yeah, but we never quite made them as partisan as these maps. You know, Beloit was like cut right in half. Racine and Kenosha cut right in half. You know, and people were out of their own homes if they wanted to stay in their district. I think we should have done that. That would have been something. In retrospect, that we should have really, well, we had the majority, we should have really worked on changing redistricting, have a nonpartisan agency like the LRB. We didn't have sophisticated computers at that time, too. You still had people hand-drawing maps. Now you can press a button and have a map done in an hour by a computer. So, one of my...
You didn't run for re-election in 2010. Why is that?
Right. I turned 70, and that's a sentinel birthday. I had served for 23 years in the legislature, and it was a privilege and honor, and it was just time to move on and let the next generation take over. That was a big birthday. Can't do it. I never thought I would last 23 years.
Really?
Yeah. It's almost a quarter of a century. So 70 was a sentinel time. You know, 80 would be a sentinel time. Well, you change your priorities and look at life differently and want to do something differently.
And what have you done since? What have been your activities?
Well, I'm a volunteer on a lot of boards. One of the boards I'm on is the Wisconsin Center for Nursing. Before I left the legislature, we increased the licensure fee for nurses and put money into the Wisconsin Center for Nursing, and it's given to the Workforce Development Board, and then they give out this money. And our job is to improve the quality of health care in Wisconsin by making sure we have an adequate, well-educated nursing force. And we have been meeting, and this board has been very active for the last 5 years, and I serve on the Wisconsin Center for Nursing Board. My term is up, and now I'm sort of an advisor. I also serve on the Metastar board, which is a medical board which works on improvement of quality health care. And I'm also on the library board. I serve as an usher at church. I'm very active in the League of Women Voters, and I still haven't gotten out of politics. I still help with campaigns, and I have a lot of fundraisers for people. I have a executive ranch house, and it lends itself well to having a lot of fundraisers.
So you still endorse candidates and back them in an election?
Right, and help them raise money, and also give advice. And then I do a fair amount of traveling as well, but my daughter lives in Krakow, Poland. She's teaching at the British International School there, so I visited her. My son lives in Charlotte, North Carolina, so I visit him. My grandkids are in San Francisco, so I have people placed in good places, warm places where I can go and visit.
Well, that's good.
Yeah.
In a more general vein, who are some of the people that you find most memorable in the years you were in the legislature? Who do you find were most effective or most memorable, the ones that really stick in your mind?
Tom Loftus, Speaker Loftus. He was the first speaker or first leader that I worked with. But he was very intelligent, very charming, and very funny. And he was an incredible orator. And so he could move the assembly in directions that no one thought they could possibly move in. And I was quite impressed with him. I also liked Mary Panzer. I thought she was a very good majority leader. She was smart, she was savvy, she put up with a lot of grief, as we leaders do, and she was able to be very, very brave. I don't know if you remember Tabor, the Taxpayers' Bill of Rights.
Yes.
And it really cripples government. And she had such a strong institutional knowledge and background that she was able to keep that Tabor from coming up for a vote. Her caucus was just, you know, so rambunctious and really wanted her to bring Tabor up for a vote, and it probably would have passed. And she knew what happened to Wisconsin, so she didn't let it come up for a vote. And then she was primaried probably for that reason, and then lost her election. So she was somebody that I thought I admired very much. I also liked Dale Schultz. When I was minority leader, he was majority leader, and he was very charming, very smart, and very inclusive, and he always was very respectful to the minority. And I thought he was just a very, very good person
worked well
to
together,
work. And of course, there's Tom Barrett, who took me under his wing, and he was my mentor. He showed me the ropes. He gave me a little place when I didn't have an office right in the beginning. And through the years, when I became, when he moved up and senator and congressman and now mayor of Milwaukee, we've stayed in touch. And I admired his ability to get along with people, but also he's very smart, and he is a real policy wonk. So he's able to translate all that policy into working with people and getting it to happen. So he was amazing.
Over the years, at times, you've emphasized the importance of having women in the legislature and positions of power. How has that progressed? What was your role in that? Do you think its progress has been satisfactory to you?
Well, I don't think, when I was elected, there were a lot more women than there are right now. And I think that if you don't have enough women represented, that democracy in the legislature is not well served. Because women bring an enormous difference of voices, background, experiences, and to the legislature, and they enrich it. And not having enough women there doesn't make democracy or the legislature work as well. And I think that their leadership style, as I'd mentioned before, is a little different. You know, when you think about a leader, they're often these male-oriented words: aggressive, strong, vicious, real strong leader words. And those are real male-oriented. When you think about words associated with women, it's collaboration, interpersonal skills, kind, and those words don't necessarily jive with the legislative leadership or traditional and the culture of that. But you want to change that culture as well, and I would think that sometimes we think Congress should be a little kinder, have better interpersonal skills, and be a little gentler and have more collaboration. And so I think when women come in, they can kind of change that dynamic and to change that mentality or that culture. And I think that I have been working very hard to make sure that happens. I've been very active with Wisconsin Women's Network, and we have a policy institute, and we educate women to become grassroots lobbyists. And I give a speech about the amazing journey of women in politics, starting with the suffragettes and moving through the legislative process, using some of my examples and as ways to illustrate points along that path. And we teach them about using the press, how to write press releases, how the legislative process works, how to be effective, and then they have to have a hands-on experience of writing a bill and bringing it to the legislature and testifying and getting sponsors and all of that. So we have had at least 4 sessions, 4 different groups of women that have gone through the Policy Institute and have become grassroots lobbyists. They focused on elderly women issues, and now they're expanding that to include environmental issues and other issues. So I've been very active in that. And I give speeches around to women's groups about how you should get involved, and here's how you get involved, and you should run, and it's easy for you to, if I can do it, you can do it. I didn't have any political
That's what you
experience
say?
at all, right? And look how I ended up, you know, pretty good.
Anything you'd like to add?
Well, I think that this has been very good. I have looked at 23 years of press releases and binders and notebooks, and I want to, because of this interview, I want to put them together in some coherent fashion and maybe write something up, and if not for me, for my grandkids, so that they can see, you know, how a woman comes through the process and changes from being a staff nurse and a teacher to move up to be a very powerful majority leader, and the pitfalls along the way, and the friendships you develop, and the enemies that you forget.
Well, as you mentioned, another senator from the 15th has a book out, so.
Yeah, right. It's a very good book. We might read it for book club. Yeah,
Okay.
It's very good. Yeah, he's very good. Well, I think we've just about
All right.
covered just about everything.
Thank you
Yeah,
for coming, Senator.
Thank you very much.